No one is exempt from social distancing. We should all keep that 6-foot space between us, whether we are in public situations or in workplaces. The mask becomes most important when you will be in a place where you cannot guarantee that you will be 6 feet from other individuals. Therefore, when you see people in town walking outdoors who may be 6 feet or more apart, the mask is not as important as when they will be in a social place or a workplace where that could not be guaranteed. We're all under the stay-at-home guidance. Certainly those people who need to go get groceries or medication at the pharmacy, when they do so, should be wearing their mask and abiding by the 6-foot distancing. But that mask gives that additional protection not only from you contacting the germs, but from you transmitting the germs. COVID-19 is a reportable disease in the state of Connecticut. So all of the information goes into a database, and each town is responsible for the follow-up with their residents. So the health department here in Windsor calls each individual who has a positive laboratory test and follows up with them 2 to 3 times a week, talking about their symptoms, their date of onset, and then what it means to be in isolation or quarantine. Individuals who test positive for COVID-19 are placed in isolation for a minimum of 7 days. Those that they have been in contact with and have had what we consider prolonged exposure within 6 feet for 15 minutes or more are contacted and placed in quarantine. The quarantine period lasts for 14 days. The reason being, the COVID-19 virus incubates anywhere from 2 to 14 days. The contact tracing will become ever more important over the next month as that project is implemented by the state of Connecticut. The town of Windsor is going to be a pilot site to check out and test the data or the system. People will be called who've been in contact with those who have tested positive and will then be placed in quarantine. The contact tracing that we've done to date has been for town staff as well as the Board of Education staff. Contact tracing of additional individuals will start in the next 3 weeks as the new software is implemented. And so it will be up to the Windsor Health Department staff to initiate that contact tracing. The person who is COVID positive and in isolation is responsible for determining the list of contacts that they had, but not in contacting them. The COVID testing and reporting is confidential, and so when the calls are made, I have had residents who ask specifically who I am and why I'm asking. And that is absolutely fine. We want to make sure that you are answering the phone and the questions to persons who are qualified to ask. And it does remain confidential in terms of the quarantine process and the contact investigation. That information, again, remains confidential. So the person being called would be told they've been in contact with someone who tested positive for COVID-19, not the name of the person who they were with. When we've called folks who have tested positive for COVID-19, we review the kinds of interventions you should make at home. We talk about separate bathrooms and separate bedrooms, frequent cleaning of surfaces and commonly touched items, and masks at home if you're symptomatic and coughing. All of this information can also be found on the Town of Windsor website under coronavirus. Towards the bottom of the page, we have information that will connect you to the CDC and hope that it is organized in a way that makes it easily accessible to you all. Be well, and remember that the Windsor Health Department is here to answer questions, and so feel free to call us if questions come about.